Computer neck, or iHunch, is the common spinal problem which characterizes neck pain and neck stiffness. It is clinically recognized as a form of repetitive strain injury. Much bending forward has always caused the problems of a hunched upper back and neck pain, for example in dentists, surgeons, and hairdressers. But last decade, neck pain became very common among new generation and people who constantly work at computer. Younger generation regularly uses laptops, tablets and smartphones. Because their screens do not separate from their keyboards, these small devices cannot be set up ergonomically correctly. Neck pain also develops in people who use desktop computers, for many hours a day. Local pain, cervicogenic headache and referred pain extending down the arms can arise from the sustained muscle strain, cervical facet joint, or apophyseal, or zygapophyseal joint, compression and diminution of the cervical foraminal nerve exits. Symptoms include overuse muscle pain and fatigue along the back of the neck and reaching down to the mid-back, often starting with the upper trapezius muscle bellies between the shoulders and neck. Cervicogenic headache from the joints and muscle attachments at the top of the neck is common. A hunched posture also sends out a body language message of submission and lower self-confidence. In a neck with perfect posture, as seen for instance in young children, the head is balanced above the shoulders. In this position the load on each vertebra of the cervical spine is spread evenly between the two facet, apophyseal joints at the back and the intervertebral disc and vertebral body at the front. The eye hunch is characterized by a posture with vagi at the head sitting somewhat forward of the shoulders, i.e., the ear lobe is anterior to a vertical line through the point of the shoulder, acromion process. This can be very marked, with the back of the skull positioned anterior to the breastbone sternum. The chin is poked forward. When the patient is asked to look up at the ceiling, the hunched forward upper thoracic curve does not change as viewed from the side. Rather, the lower cervical spine hinges backward at C5/6/7, a movement pattern known as swan necking. The gravity of stress on the spine dramatically increases with thoracic hunching. Roughly 10 pounds of weight are added to the cervical spine in weight for every inch of forward head posture by looking down at a small IT device. Some rheumatoid conditions like ankylosing spondylitis, neurodegenerative conditions like Parkinson's disease, and connective tissue disorders like Ehlers-Danlos syndrome cause characteristic excessive thoracic kyphosis. More than 2 hours a day spent on computers was associated with a moderate/severe increase in musculoskeletal pain. In the following year, the average UK 18-24-year-old spent 83 hours a day in front of a PC, laptop, phone or tablet. Treatment: nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, pain relief medications, analgesics, such as acetaminophen, low-dose tricyclic antidepressants such as amitriptyline for chronic problems, physical therapy, aka physiotherapy and British-derived cultures, including gyms and Pilates, postural approaches such as the Alexander technique, stretching approaches such as yoga. Neck pain due to computer/smartphone is also known as e-hunch, eye posture, forward head posture, poking chin posture, wearsie neck, computer neck, upper cross syndrome, text neck, and dowager's hump. Prevent computer neck pain. Maintaining good posture by sitting up straight is an important way to prevent pain. Make a point of being mindful about your seated posture. Because during the day we all tend to slouch. Throughout the day, rotate your shoulders back. Hold for a few seconds, relax and repeat the move 3 or 4 times, recommends Dr. Christo. This exercise can be done sitting or standing. Look straight ahead. Now look down at the floor for a few seconds and then up at the ceiling for a few seconds. Now turn your head very slowly to the right, hold this position 3 seconds, then turn head left for 3 seconds. And then back to the center. Repeat 3 to 4 times. Sit up straight, facing forward, tilt your head to the right and try to touch your right ear to your right shoulder. Hold for a few seconds. Relax and straighten your head. Now tilt your head to the left and try to touch your left ear to your left shoulder. Repeat 3 or 4 times. Stand up and lift your elbows out to your sides, rest your hands on the back of your head. Pull your elbows back slightly while stretching out your spine. Your eyes should be looking ahead. Hold this for 10 seconds. Repeat 5 times. Be conscious of your posture while seated at your desk. You should be sitting up straight and the keyboard should be placed so that your elbows are flexed at 90 degrees, make sure your shoulders are back, and don't slouch.